There's a piece of research that was recently done that I think answers a really important question about what people talk when they say asymptomatic transmission. And it's very, very important because early in the pandemic, I had thought that this research was the most important piece of research that we needed to help understand what was going on. And I've only started to go through this paper, but it answers a number of questions that I had from all the way back in 2020. And the question was really about what happens in the period of time between infection and the onset of symptoms in the person who has asymptomatic or subclinical COVID? Very important question. So I'm going to take you through that. Now, before I start, just a quick reminder that I'm doing the unseen threat is measles. Is it about to intensify amid COVID? A really important presentation here. So I want you to join me because in this presentation, I will be covering the way how measles infection works. It's a fascinating infection in the sense that it has an entry point that's different from its exit route. And the way how patients die with regards to pneumonia, I have a very innovative thought as to what causes that severe pneumonitis. Say, for instance, a child who died recently, sad to hear. But if you want to learn more about that and why I think that this is a big issue in the background, you need to join me for that webinar. It's next week, Thursday. So please click on the link below in the description. So let's get back to this question that a lot of people have been arguing about for some years. And they have been saying that if you haven't had any symptoms, you don't have any problems with COVID. Okay. So essentially what this is about is that some people believe that there is no such thing as asymptomatic spread. So meaning if you had no symptoms, you can't spread the virus. That's completely flawed. And actually, I'd go further is that there is no such thing as asymptomatic COVID. There is subclinical COVID. Okay, very important difference. So here is what I put together some time ago, and I'm reminding you of it. When you get infected first, and this is important then and even more important now because so many people have so few symptoms. When the virus infects the upper airway, there are no obvious symptoms. And it then replicates in about a 10-hour cycle. And this emphasizes the importance of mucosal immunity to try and prevent the infection from occurring. And this is what happens really, really quickly on exposure. And what I put together here was that the normal healthy lungs, this is what they look like. They're in your chest. There are two of them. They exchange oxygen with blood. They remove carbon dioxide. And the surface area of these lungs, when you spread out the alveoli, is approximately the size of half the area of a tennis court. So there is a lot of surface area for you to use, which is all the more reason why when we think about what happened with the lungs in severe COVID-19, you literally would have to lose almost 90% of that lung capacity for somebody to die on a ventilator in intensive care. So you had very severe inflammation occurring in severe COVID-19. And I've got here an image showing the healthy lung on the left and an inflamed lung on the right. And a lot of people don't realize that this inflamed lung on the right, a big part of it is that there's a huge accumulation of a specific kind of immune cell, macrophages in the lungs, that drive a lot of the damage in terms of COVID. The question is, when does it occur? And I'll explain to you. At the time when I was looking at autoimmunity, I knew that there were two phases, the viral phase and the immune phase. But I wanted to understand what was happening in the viral phase, where you got the infection, limited or no symptoms. Do you have anything happening in terms of the lungs? And this is now where we get the information from where the infected macaques. This was day 0 in terms of the lung And by day 2, you can see the significant inflammation. And at that time, they barely had any symptoms, but the lung inflammation was there. And this is what you would call the asymptomatic or subclinical spread of the virus. And the reason this happens is because it is so good at suppressing your immune response, the interferon response. And when you have that occurring, you therefore don't have any significant symptoms. So here is this study that I was very excited about. And just in case you don't know, I literally actively search for anything on autopsies and histology around COVID because it is so important to answer these questions. Here is this paper that was just recently published about interstitial capillary congestion and diffuse alveolar damage. It's a mouthful. And they were looking at the factual findings in lungs of autopsy cases positive for coronavirus disease. Now, what they did here, and this was done in India, they analyzed post-mortem lung autopsy samples from individuals who did not succumb to COVID-19 related pulmonary complications. Okay, this is a very, very important assessment. I was pleading for this early in the pandemic, in the sense that I was saying we have got to know what was happening in the lungs of people before they got severe disease. And you will see in effect, I'm just trying to find, um, yeah, I'm finding the cases here. This is in the paper here, the demographic details of the cause of death. There were 20 patients that were included. The average age was 45 years old. Let me make this a little bit bigger for you. The average age was 45 years old, between the age of 23 and 78. And then when they looked at the cause of death, it was oftentimes head or spinal injury. So many of these were road traffic accidents. So it had nothing to do with COVID. They just happened to die because of something else. But when they were swabbed, they were found to be COVID positive. This one here was asphyxia due to head and spinal injury. Four had cerebrovascular accidents and died. There was a cardiac arrest in one, and another one had cardiac arrest because of septicemia. So none of these patients had overt COVID-19, which is why the information was so valuable. And at the time, because it's going to be really valuable to me to look at, simply because when I was trying to understand the methodology as to what exactly happens in that early phase, to understand what happens in terms of the autoimmune phase, we didn't have any information. So here is what they found in summary. So of the 20 subjects that they looked at, there was congestion of the capillaries, that's the very small blood vessels. That was the most common change in the lung autopsies. 90% of those patients had that. 75% of them had emphysema, where there is a dilatation, almost the lungs have become a little overinflated. That's very interesting. I wouldn't have expected that. And diffuse alveolar edema. This is where they can go on to have more severe disease in 25% of the cases. In every single one of these cases, the patients died without the knowledge or without any obvious symptoms of COVID-19. And this is now really important now, because we also need to understand, because if it was like that in early COVID when the virus was novel, now that we have significant proportions of the population who are vaccinated and are not responding in the normal way in terms of their immune system, are they also having subclinical lung inflammation? And what are the longer term implications of having that kind of inflammation? Really, really important questions. And when I take you back to what happens in terms of the science, essentially, when you look at the normal lungs, these are the alveoli where the air is exchanged. And this is a breakdown as to what happens with the blood vessels. A lot of what happened in severe disease was microclotting. But in the early phase, it was just inflammation and swelling of the capillaries in the lower part of the blood vessels. So this would have been in the viral phase of the disease. And it just confirms the point that I had always said, is that in effect, even if someone is asymptomatic or subclinical, they were still spreading virus, because if the virus could spread to the lungs, it could spread elsewhere as well. And this is going to be an even greater problem now, where many people, their only symptom is fatigue. They have no idea if they've had COVID exposure. And this is a pretty significant impact, because if they take even longer to clear the virus, is this then causing chronic lung inflammation and therefore potentially progressing underlying lung disease? These are really important questions. I just thought I was excited to share some more histology and autopsy information, which we have very limited amount of. Even what we have shown you here is largely an unvaccinated cohort before the pandemic. What is happening in the vaccinated cohort? Why is nobody interested? What are the outcomes? Is there inflammation? Should we be looking out for further disease down the line? There are all these questions that seem to be inconvenient, probably to the scientific community that pushed this along, but in reality are very, very relevant to the individual patient and their health. So, as a final point, just remember the unseen threat about measles and the combination with COVID. This is a really important presentation. Join me at the link below, and we will go through as I continue to try and predict what is going to happen in the future. We aren't always correct, but we certainly will try to see if we can give you answers before they hit you like a tsunami. Have a great evening.